Welcome back to the deep dive. It is great to have you here with us today.
It's always good to be here.
Yeah, and today we're going to shift gears a little bit. Usually we're looking at these, massive abstract tech trends or global shifts. But today I want to zoom in.
Right.
I'm going to look at something that is probably sitting in your pocket or on your desk right now.
Something so completely mundane. I mean, it's so integrated into our daily lives that you probably don't even think about the actual mechanics of it anymore.
Exactly.
You tap a button, a car shows up, you get in, you get out. It's magic.
It's the Rideshare app. Uber,
Yeah.
Lyft, the absolute titans of the gig economy.
Right.
But we aren't talking about the standard use case today.
No, not at all.
We're not talking about catching a ride at the airport or heading home from a bar on a Saturday night. We are pulling back the curtain on a specific hidden layer of this industry.
And it's a layer that is growing incredibly fast.
Yeah.
And honestly, after spending the last few days with this research stack, it is teeming with risk.
It really is. It is the perfect storm where that move fast and break things philosophy of Silicon Valley.
Right, the classic tech mantra.
Exactly, where that crashes headfirst into the highly regulated, slow-moving, high-stakes world of healthcare.
Yeah, we are talking about the use of rideshare platforms for non-emergency medical transportation.
And I want to be clear right off the bat, we aren't talking about you deciding to take an Uber to the doctor because your car won't start.
Right, that's your own choice.
We are talking about insurance companies, hospitals, and third-party brokers
Yeah.
systematically using these apps to move patients.
Yes.
And often, these are very vulnerable patients, and the drivers have absolutely no idea what they're walking into.
And perhaps even more concerningly, the patients often don't realize that the person picking them up has absolutely zero medical training.
Right.
They see a car sent by their insurance company, and they just assume safety. They assume it's a medical transport.
And that is the core conflict we're exploring today. We have a really dense stack of sources for this deep dive.
We do.
We've got industry liability reports, insurance breakdowns that are, frankly, terrifying if you read the fine print.
Oh, absolutely terrifying.
And we also have a very candid, eye-opening interview with a veteran driver.
Yes, our whistleblower of sorts.
Exactly. He really exposes the gap between what the app claims is happening, seamless, efficient transport, and what is actually happening out on the street.
Which is often just pure chaos.
So here is our mission for this deep dive. We need to map out this entire ecosystem for you. We need to understand the economics, like, why is this even happening?
Follow the money.
Right. We need to look at the liability. Who gets sued when things go wrong? And we need to look at the human cost for both the drivers and the passengers.
But before we get to the horror stories...
There's plenty of them.
There really are. But before that, we need to set the baseline. You need to define some terms because the industry jargon can be a little thick.
It can be intentionally thick, I'd argue. Like it's designed to hide the reality of what's being traded.
Oh, totally.
So the first acronym that kept popping up in the research, effectively the antagonist to the rideshare model, is NEMT.
Right. NEMT, non-emergency medical transportation.
Okay.
This is the traditional, quote-unquote, gold standard of the industry. If you have a grandmother who's in a wheelchair or someone who needs dialysis 3 times a week and can't drive themselves.
Or someone recovering from a major surgery.
Exactly. This is historically what you use.
I always picture those white vans, the ones with the high roofs, the mechanical wheelchair lifts on the back.
Yep. Usually a logo on the side that says something like care transport.
Right. And that visual is important, right?
Okay.
Because it represents a very specific set of standards.
It does. Those vehicles are highly modified for medical equipment. The drivers are trained employees, not independent contractors.
It's a huge distinction.
Massive. And they carry commercial insurance specifically underwritten for healthcare transport. It's a formal part of the medical ecosystem. It's heavily regulated.
Okay, so that's one side of the spectrum, safe, regulated, specialized. On the other side, we have what the industry calls ambulatory options.
Yes.
And this is where things get really murky.
Ambulatory. It's a clinical term. Right. In a strictly medical dictionary, it essentially just means capable of walking.
But in the context of this deep dive, that definition seems, well, let's say elastic.
Highly elastic. I mean, in a perfect world, an ambulatory patient is someone who just needs a basic ride. They can walk out to the curb on their own, open the car door, buckle themselves in, and get out at the clinic.
Right, they don't need physical assistance.
Exactly. But as we're going to find out, the reality on the ground is often someone with a walker, someone who is legally blind, someone who's post-surgery and super groggy from anesthesia.
Or someone dealing with severe addiction issues.
Right. They are ambulatory only in the strictest technical sense that they aren't physically strapped to a hospital gurney.
Wow. And this is where the disruption happens. Because medical providers and insurance brokers, they looked at those NEMT vans
Which are very expensive to operate.
because of all that safety gear and regulation.
Exactly.
So they looked at those, and then they looked at Uber and Lyft, and they did the math.
They realized they could just call a regular passenger car for a tiny fraction of the price.
It's pure arbitrage.
Pure arbitrage. Why pay $50 or $80 for a specialized medical van when I can just book a generic rideshare for $12? The logic is completely financial.
So let's jump into the mechanics of this, because this is the part that I found really confusing initially.
Okay.
If I'm a driver, let's say I'm out driving my normal Tuesday shift, does my phone scream at me? Does it flash a giant medical alert banner? How do I even know I'm doing a medical run?
You don't, at least not explicitly. And that is the very first major failure point we really need to discuss. It's what the research calls the middleman dynamic.
Okay, let's unpack that. How does the request actually travel from the patient to the driver's phone?
So, usually, when you or I use a rideshare, you are the account holder. You book the ride on your own phone, you pay for it with your own credit card, you track the car on the map.
Right.
The relationship is peer-to-peer. It's just mediated by the app's algorithm.
Sure, very straightforward.
But in these medical scenarios, there is a third-party broker involved.
Like a middleman.
Exactly. This could be a specialized logistics company, it could be a hospital discharge planner, or maybe an insurance coordinator sitting in some call center 3 states away.
And they are the ones with the app.
Right. They have the commercial business account. They are booking the ride on behalf of the patient. The actual patient standing on the curb might not even own a smartphone.
So the driver just gets a regular ping. It looks like a totally normal request.
Mostly, yes. But there are little clues,
Yeah.
and this is where we get into the whole B-leg mystery that our veteran driver brought up.
Okay, B-leg. I had to stop reading the transcript when I saw that because it sounded like military code or something out of a spy novel. What on earth is B-leg?
It comes directly from the driver we studied. He talks about accepting a ride and then immediately getting a text message from the requester.
From the broker.
Right. But it's not a helpful text like, hey, I'm wearing a red hat. It's just a cryptic code. B-leg.
Just those letters. B-L-E-G.
Yep. And the driver assumes this stands for.
Bad leg.
That's the best guess. Think about how insanely informal that is. You are dealing with a legitimate medical condition that affects human mobility, and the entire safety protocol is reduced to a 5-character text message sent through a chat box.
B-leg. It feels like a whisper network. Like they're trying to warn the driver without officially admitting what the ride actually is.
That is exactly what it is, because if they formally admit in writing that it's a medical transport requiring specialized physical assistance, they might trigger a completely different liability category.
So they use vague, deniable notes.
Exactly. The driver also mentioned getting notes like front door pickup or no deviating from route.
No deviating from route. That sounds incredibly strict for a rideshare. I mean, usually if I ask my driver to swing by a drive-thru or a gas station, it's up to them, but it's certainly not forbidden.
It's strict here because it's an insurance ride. The broker is paying specifically for point A to point B. They are actively auditing that GPS track.
Wow.
If the driver stops at a McDonald's, the broker might refuse to pay the invoice because to them it looks like fraud or misuse of funds.
But the driver doesn't know why they can't stop. And the passenger, who might be confused or just really demanding, certainly doesn't care about the broker's corporate audit trail.
Which puts the driver in a terrible position. But it actually gets worse. Let's talk about the communication black hole.
Oh, this is the most frustrating part of the operational breakdown for me. Because in a normal ride, if I can't find you, I just call you. The app connects us anonymously. Simple.
Right, but in this middleman scenario, the phone number attached to the account doesn't belong to the patient.
Because the broker booked it.
Exactly, it belongs to the call center, or the main hospital switchboard, or a dispatcher in a completely different time zone.
So the driver shows up at a massive medical complex. He's looking for a Mary. He can't see her. There are 3 different exits. So he calls the number in the app. And what happens?
He gets an automated phone tree. Thank you for calling General Hospital. Press 1 for billing. Press 2 for appointments.
Well, he's illegally double parked in an active ambulance, so...
Exactly. Or, as the driver mentioned, it just goes to a deadline or a disconnected number because the outbound number masked by the service simply does not accept inbound calls.
He said 80 to 90% of the time with these third-party rides, you literally cannot contact the actual human being you're supposed to pick up.
Just think about the sheer inefficiency of that. You are just sitting there, idling your engine, burning your own gas.
And wasting time. And in the gig economy, time is the only inventory you have. If the wheels aren't moving with a paying passenger inside, you are actively losing money.
And that leads us directly to the financial disconnect. Because this is where the exploitation, and I really do not use that word lightly, really becomes apparent.
Let's talk about the money. Because you mentioned earlier that the brokers are saving money by using rideshare. But how much of that savings actually trickles down to the driver?
Very, very little. The sources highlight a concept called arbitrage.
Okay, let's break that down for people.
The brokers or the NEMT companies often did for these big state or county medical transport contracts.
Yeah.
They get paid the official medical transport rate.
Which is higher?
Much higher, because it assumes specialized care, high overhead, commercial insurance, trained staff.
Right, they're getting paid the gold standard rate.
Exactly. So let's say the reimbursement rate for a specific medical transport trip is $60.
Yeah.
That rate exists because it assumes the provider has all that expensive overhead, but the broker doesn't send a $60 wheelchair van. They just tap into the Uber or Lyft API and book a standard consumer ride for $12.
So they just pocket the difference.
They pocket the massive spread. Meanwhile, the driver is earning standard consumer rates. Our driver mentioned making anywhere from $4 to $15 per trip.
$4 to transport a medical patient.
And here is the absolute kicker. There is zero chance of a tip.
Because the passenger isn't the one paying.
Exactly. The passenger thinks it's a completely free service provided by their health insurance. They often don't even have the rideshare app on their phone to tip if they wanted to.
And the broker?
The broker is certainly not going into the app and adding a 20% tip for the driver out of the goodness of their heart. They're trying to maximize their corporate margin.
So the driver is doing extra work, taking on extra liability for what is essentially the lowest possible payout on the entire platform.
The driver we researched was pretty vocal about this. He said he felt like these rides were explicitly set up to, his words, screw you. And when you look at the raw math, it's really hard to argue with him.
It is. He specifically mentioned the deep frustration of being paid as a regular driver while being fully expected to perform medical transport duties.
It's a misclassification of labor, essentially.
And that segues perfectly into the next big problem, the training void. Because if you are only getting paid regular gig driver rates, surely you aren't expected to have paramedic level skills, right?
I would hope not. But the expectation from the passenger, and often from the broker who booked the ride, doesn't match the reality of the driver's resume at all.
Let's look at the baseline. If I am a legitimate NEMT driver driving that white van with the medical logo, what do I legally have to do?
It is rigorous. According to the regulations in places like California, for example, you need a commercial business license. You need specific hands-on training on safe physical transfers.
Meaning how to physically move a person from a wheelchair to a car seat without dropping them.
Right, or without destroying your own back in the process. You also need full CPR certification. You need first aid training. And you are subject to regular random drug testing.
That makes perfect sense.
Okay.
You are transporting highly vulnerable people. Now let's look at the rideshare requirement. What do they need? Do you have a pulse? Do you have a driver's license? Is your car less than 10 years old?
That's pretty much it.
Wow.
There is absolutely no requirement for healthcare adjacent training. A rideshare driver doesn't need to know CPR. They don't need to know how to properly fold or handle a walker. They certainly don't need to know what to do if a passenger suddenly has a seizure in the backseat on the freeway.
But the apps are aware of this, right? They're trying to bridge this gap somehow. I saw something in the notes about an opt-in feature.
Ah, yes, the opt-in illusion. Some platforms have rolled out a feature where a driver can essentially volunteer to assist passengers. They pop up a message that says, "Hey, are you willing to help people with walkers or help fold a wheelchair?"
And what do they get for taking on that extra responsibility?
In some cases, an extra $4.
$4. To physically assist a fragile human being into a vehicle on a busy street?
And here is the real problem with that. Just because you click an opt-in button on your screen doesn't magically mean you know what you were doing.
Right.
The platform isn't sending you to a weekend seminar on patient mechanics or safe lifting techniques. They are just paying you $4 extra to try your best.
And that is terrifying.
Yeah.
Because the driver we listened to, he seems like a genuinely good guy. He literally said, I'm a compassionate person. I don't mind helping.
And that is exactly what the entire system relies on. It relies purely on the kindness of strangers.
Yeah.
He talks about this elderly blind couple he drives regularly. He loves them. He helps them to the door because it's the right thing to do. But relying on individual human compassion is not a corporate safety protocol. It's a gamble.
It's a systemic risk masked as charity.
Precisely. Because what happens when the driver isn't him? What happens when the driver is impatient or physically unable to lift heavy things or just doesn't care?
Well, let's talk about what happens when the physical reality just doesn't work. We need to talk about the square peg in a round hole problem.
This is where the operational nightmares really come into focus.
The story he told about the wheelchair, I couldn't believe it when I read it.
It is a textbook example of bureaucratic incompetence.
So paint the picture for us. What happened?
So he gets a request. He drives to the pickup location, a residential house. A woman comes out to the driveway and asks, "Are you here for so-and-so?" He says yes. And she basically just sighs, looks at him, and says, "You're the third one."
The third driver.
Yes, because the actual patient inside is a man in a wheelchair who has a leg cast that is stuck straight out, like completely horizontal and rigid.
Okay, so just physically looking at a standard sedan, a Honda Civic, a Toyota Camry, there is no geometry in the known universe that allows a man with a straight leg in a wheelchair to fit into the back seat of a sedan.
It is physically impossible. He needs a specialized van with a mechanical lift and plenty of room for the leg extension.
Right.
But the broker, whoever was sitting at a desk booking this ride, just kept hitting request ride on the Uber or Lyft dashboard.
And they sent 3 different drivers.
Think about the massive waste there. 3 independent drivers drove to that house, burned their own gas, wasted their own time, and got paid absolutely nothing because the ride fundamentally couldn't be completed.
And the patient.
The patient is just sitting there, inside, probably in pain, certainly delayed for his medical appointment, and the family is incredibly frustrated.
And why does this happen? Is it because the broker doesn't want to pay for the extensive van? Or they just didn't check the right box on their intake form?
It's likely a combination of cost-cutting and aggressive automation. The system sees transport needed. It automatically defaults to the cheapest available option via the API. It simply doesn't have a data field for a leg cast sticking straight out.
It's completely absurd. And for the driver, this is just a total loss. You don't get a cancellation fee if you show up and physically can't take the passenger.
Right.
Yeah.
Usually not in this specific context, no. Or if
Yeah.
you do, it's a tiny, tiny fraction of the fare. The driver really emphasized this. Wasted time. In the gig economy, time is your only inventory. If you are sitting in a driveway arguing with a stressed family about wheelchair geometry, you are actively losing money. You could be taking a ride to the airport.
And then there's the other side of these operational nightmares, the unreasonable demands. We talked about the no deviation rule earlier.
Yes, this is a fascinating conflict of interest. The driver essentially has a boss, the app, or the broker who ordered the ride.
Right.
And the boss says, drive from the clinic directly to the home, do not stop, do not deviate. But the driver also has a customer physically sitting in the back seat.
And the customer says, hey, I really need to stop at the 7-Eleven.
Or the smoke shop.
Right.
The driver specifically mentioned methadone clinic trips where passengers demand stops at convenience stores or smoke shops on the way home.
So the driver is stuck in the middle. If they say no, the passenger gets angry. And an angry passenger locked in a small metal box with you is a genuine safety risk.
Exactly. But if they say yes and make the stop, they might be violating the contract with the medical broker, or they just flat out might not get paid for the extra mileage and time.
And he mentioned threats, right? Like passengers threatening to get him fired if he didn't comply.
Yes. He detailed a situation where a passenger was a complete no-show. He waited the required 5 minutes, canceled the ride in the app, and drove away.
That was standard procedure.
Standard procedure. But the passenger somehow called him later, which is super creepy in itself, and threatened to call the company and get him permanently deactivated.
Maybe she missed her ride.
Because she claims she scheduled it for 10, even though the automated request came through to him at 8.45.
That is the ultimate nightmare. You are caught between a glitchy, automated broker system and a frustrated, sometimes irrational patient, and your entire livelihood hangs in the balance.
And all of this The miscommunication, the wrong vehicles, the threats, it all leads to the biggest, darkest cloud hanging over this entire industry: liability.
This is the part of the deep dive that legitimately scared me. Because I think most drivers just naturally assume, hey, I'm driving for a multi-billion-dollar tech company. If something bad happens, they have my back. Their insurance will cover it.
That is a wildly dangerous assumption. Let's talk about the legal concept of operating out of bounds.
Okay.
The entire rideshare model is built on a very strict curb-to-curb service model. The contract you agree to essentially says the driver pulls up to the curb, the passenger gets in, you drive to the destination, the passenger gets out, end of transaction.
Very clean.
But with medical transport, especially these quote-unquote ambulatory patients who actually need help, that model completely breaks down. If a driver gets out of the car, walks up to the front door, helps grandma down the front stairs, and holds her arm as she walks to the car door.
Which just sounds like good, decent customer service to a normal person.
It does. But in the cold, calculating eyes of the insurance company, that might be considered operating outside the service parameters.
So if grandma trips on a crack in the sidewalk while the driver's holding her arm,
The rideshare insurance might entirely deny the claim. They could easily say, you weren't driving. You were providing physical care. That's not what we insure.
which leaves the driver. Where, exactly?
Personally liable. That means the driver, who we already established is making maybe $4 on this trip, could be sued personally
For the medical bills.
for the hospital bills, the surgery, the pain and suffering, the ongoing liability of that fall, all of it.
That is absolutely terrifying. Lawsuit after lawsuit, I think the driver said.
And it's not just slip and falls. There's also the massive issue of HEPA.
The federal privacy laws.
Yes, legitimate NEMT providers are thoroughly trained on HIPAA compliance. They know exactly how to handle sensitive patient confidentiality.
Right.
Rideshare drivers are not. If a driver inadvertently exposes patient data or discusses a patient's medical condition with someone, or even just handles a discharge clipboard they shouldn't be touching, they are walking into a federal legal minefield that they don't even know exists.
And they are risking federal fines for the price of a cup of coffee.
Honestly, less than a cup of coffee after you factor in the gas.
We really need to talk about the insurance gap in more detail here, because the sources made a huge distinction between commercial and personal insurance.
Right. A proper medical transport company carries commercial general liability insurance explicitly designed for medical scenarios. It covers the messy what-ifs of healthcare.
Right.
Rideshare insurance is a hybrid consumer product. It's designed strictly for transport, not care.
So it covers the car crash, but not the care crash.
That's a great way to put it. If you crash the car in an intersection, the platform's insurance kicks in. If the passenger suddenly has a heart attack in the back seat and you pull them out of the car and accidentally break their rib doing CPR, that's a massive gray area.
But wait, surely there are Good Samaritan laws that protect people in those situations.
There are. And the driver we listened to actually mentions them. He says, hey, I know CPR. I'd probably be okay under Good Samaritan laws. But here is the critical legal nuance. Good Samaritan laws are usually designed specifically to protect innocent bystanders who jump in to help for free in an emergency.
Oh, but the driver's on the clock.
Exactly. The driver is being paid. Once you accept money to transport that person, are you still a Good Samaritan? Or are you a negligent independent contractor who failed to provide a professional standard of care?
And do you really want to test that legal theory in civil court?
For a $4 fare? That is an insane gamble. Relying on a Good Samaritan defense for a commercial gig transaction is a massive, massive risk.
Okay, we've talked a lot about the drivers and the risks they face, but I want to pivot to the passengers. Because if I'm a listener and I'm sending my dad to the doctor or my grandmother to physical therapy, I'm trusting this system.
The passenger's risk profile is honestly just as concerning as the driver's.
Who are these ambulatory passengers really? Because we established they aren't just athletes with a sprained ankle.
Right. They aren't just people who happen to not own a car. These are seniors with very low stamina, post-surgery patients still heavily groggy from anesthesia, people with severe balance issues, people dealing with early dementia, people in addiction recovery.
These are highly vulnerable people.
Extremely. And the app interface gives this incredibly false sense of security to the family.
Right, because you see the little car icon moving smoothly on the map.
You see a driver rating of 4.9 stars, and you think, okay, they're safe, it's an official medical ride, it's monitored.
But in reality, it's just a random contractor who might have started driving 2 days ago.
And because of the incredibly low pay we discussed earlier, we see a really dangerous economic phenomenon happening. It's called adverse selection or the cherry picker effect.
Oh, the driver talked about this. He actually calls himself a USDA cherry picker.
And he absolutely means that as a compliment to his own business sense. Experienced gig drivers, the veterans who really know the city, know the risks, and are actually good at their jobs, they quickly learn to identify these medical rides.
And what do?
They decline them
Instantly.
instantly. He sees a ride request popping up from the hospital zone, or he gets that cryptic text that says B-leg, and he just ignores it. He wants the easy airport run. He wants the business traveler with the briefcase.
So if all the experienced, smart drivers are rejecting these medical rides, who is left to pick up the patient?
The drivers who don't know any better.
Wow.
The rookies. The desperate ones. The ones who haven't figured out the math yet, that these rides are guaranteed money losers.
So you have the most physically vulnerable passengers in the entire city being actively paired with the least experienced, least savvy drivers on the road.
It is a complete recipe for disaster. You are systematically filtering out the highly rated veterans of the world and leaving the fragile patients with drivers who might not know the city streets, might not speak the language well enough to communicate with a confused dementia patient, or might just be totally stressed out and desperate for any fare they can get.
That is a really disturbing realization. The algorithm effectively filters for the worst possible match for the patient.
It does. By artificially underpaying for the labor, they ensure that the highest quality labor exits that specific pool immediately.
So let's try to synthesize all of this. Let's look at the bigger picture here. We essentially have two entirely different structural systems violently crashing into each other.
Yes. We have the traditional NEMT structure and the modern rideshare structure.
Let's compare them. NEMT is fundamentally built on accountability.
Absolutely. It's built on healthcare coordination, rigorous documentation, federal compliance. It's inherently slow, it's very expensive, but it is deeply safe.
And rideshare is built on
Speed, minimal friction, low cost, radical independence. It is entirely a consumer framework.
And the ultimate conflict we are seeing today is that we are trying to force a complex medical need into a frictionless consumer app model.
Exactly. It creates massive friction. And that friction produces real-world danger. It produces the terrifying legal liability we talked about. It produces the operational nightmares of sedans showing up for straight-leg casts.
And there is a profound moral question here, isn't there?
There really is. Is it ethical for medical providers and insurance companies who, let's face it, are often flush with cash to just pocket the difference?
That race to the bottom concept we keep seeing in the gig economy.
Exactly. They are directly subsidizing their massive logistics costs by exploiting the gig economy model. They are legally transferring the high cost of safety from their corporate balance sheet to the gig driver's personal liability column.
They are saving $50 on a sterilized van. But in doing so, they are risking the driver's entire livelihood and the patient's physical safety.
And the craziest part, the driver doesn't even know they are part of this corporate equation until they pull up to the curb and see a wheelchair.
So what does this all mean for us? For you, the listener?
I think we need to clearly summarize the key takeaways here because it is a lot of complex information to process.
Let's do it. Takeaway 1. The drivers.
The drivers are vastly underpaid for the actual work they are doing, and they are massively overexposed to personal legal risk. They are basically acting as untrained paramedics for sub-minimum wage.
Takeaway 2. The passengers.
The passengers are being subjected to highly unreliable transport. They face the wheelchair mismatch, where they might be left stranded on a sidewalk. And because of the economics, they're almost always riding with the least experienced drivers available.
And takeaway 3. The system as a whole.
The system works beautifully for the brokers, it works for the bottom line of the insurance companies, but it absolutely fails the actual human beings sitting in the car.
It really does feel like a fragile house of cards. I mean, one bad accident, one major, highly publicized lawsuit, and this whole ambulatory rideshare model could come crashing down overnight.
Or, sadly, it might just continue exactly as it is. Because the financial savings are just too good to pass up for these big companies. And the individual tragedies of these drivers and patients, they are just quietly written off as the cost of doing business.
That is a remarkably bleak thought.
It is the stark reality of the gig economy meeting the healthcare system.
So here is a final thought for you to mull over. We always like to leave you with something provocative at the end of a deep dive.
We've talked deeply about the money, the liability, and the lack of training. But I really want you to think about the concept of trust.
Right. If you or a loved one, your mom, your grandfather, needed medical transport tomorrow and the insurance coordinator on the phone said, "Don't worry, we have a car coming for you right now," would you trust it?
Knowing what you know now, would you trust an app that you know pays the driver $4 and provides absolutely zero medical training to safely transport the most important person in your life?
And for the drivers listening out there, and I know there are a lot of you who tune in, ask yourself this. Is the severe anxiety of a potential medical emergency in your backseat, the risk of a life-ruining lawsuit, the stress of getting that cryptic B-leg text, is all of that really worth the price of a cup of coffee?
It's a heavy question, and it's one only you can answer, but you absolutely need to know the risks before you accept that ride.
Absolutely. This has been a heavy one, but an incredibly important one. We hope this deep dive helps you look at those cars passing by a little differently.
Think critically about the logistics behind your healthcare, because it really does matter.
Thanks for diving deep with us today. We'll see you on the next one.
Stay safe out there.